Hello, and welcome to Montclair State University student COVID-19 return to campus training. The university created this video to outline the safeguards and protocols established to help keep you and others safe. This guide has been developed to comply with the governor's executive orders, reflect guidance of public health authorities, and are based on the best currently available scientific information about how to reduce the risk of spreading COVID-19. Let's begin. Scientific experts believe that the virus is most commonly transmitted by direct person-to-person respiratory spread. This occurs when a person with infection coughs, sneezes, or talks to another person, and the droplets make direct contact with the mucous membranes of another person. An asymptomatic person can transmit the virus. That means a person without any symptoms can unknowingly spread COVID-19. Droplets can be inhaled into the lungs, which is why it's important for you to maintain a 6-foot distance from others. Infection can also occur if a person touches an infected surface, then touches their eyes, nose, or mouth. For the health and well-being of you and your fellow Red Hawks, we've instituted the following safeguards and safety measures. All students must complete daily self-screening using HawkCheck 6 to 12 hours before arriving on campus. If you live on campus, you need to complete HawkCheck daily before leaving your room. Stay home if you have any symptoms. Symptoms include fever of 100.4 degrees Fahrenheit or above, cough, chills, trouble breathing or shortness of breath, muscle or body aches, sore throat, new loss of smell or taste or change in taste, nausea, vomiting, or diarrhea, headache, congestion, and fatigue. Face coverings are required in all public and shared spaces, and whenever it is difficult to maintain a minimum of 6 feet distance, which includes outdoor spaces, cloth face coverings are preferred. If you think you are unable to wear a face covering, contact the Disability Resource Center, who will review your situation. Students are to wear face coverings in classrooms, labs, libraries, and other instructional or study areas, non-private workspaces including workstations and open areas, elevators, stairwells, hallways, and university-operated shuttles and buses. Face coverings are not required for student athletes when engaged in organized activities, performing arts students when engaged in organized activities, and children under the age of 2. Before putting on your face covering, be sure to wash your hands. Be sure to cover your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face and make sure you can breathe easily. When removing a face covering, first wash your hands. Remove a cloth face covering by the straps or ties. Be sure to not touch your eyes, nose, or mouth. Carefully fold the outer surface inward to reduce contact with surfaces during storage. Wash your hands thoroughly or use hand sanitizer after handling. Respect social distancing signs, barriers, and protocols. Be sure to keep a minimum of 6 feet from others at all times. Make sure to follow all building and classroom signage. Be sure to follow signs for entering and exiting classrooms. Avoid grouping in the hallways and do not move any furniture. Your academic success is still vastly important. Meet with instructors outside the classroom through online office hours or scheduled appointments instead of face-to-face one-on-ones. Washing hands with soap and water removes pathogens and dissolves the oily membrane on the virus. Alcohol-based hand rubs with the recommended alcohol concentration will also inactivate the virus that causes COVID-19. Wash your hands often, especially after you have been in a public place and touched an item or frequently touched surface, after blowing your nose, coughing, or sneezing, before touching your eyes, nose, or mouth, after using the toilet, or after touching garbage. It is also important to wash your hands before, during, and after preparing food, before eating food, before and after treating a cut or wound, after changing diapers or cleaning up a child who has used the toilet, after touching an animal feed, or animal waste. Follow these 5 steps for good hand hygiene with the use of soap and water. First, wet hands with clean running water and apply soap. Secondly, lather hands by rubbing them together. Lather the backs of your hands between your fingers and under your nails. Scrub hands for at least 20 seconds. Try humming the happy birthday song from beginning to end twice. Rinse hands under clean running water. And lastly, dry hands using a clean towel or allow them to air dry. If you're using hand sanitizer, be sure it meets CDC criteria. Apply the recommended amount to the palm of one hand. Rub hands together and continue rubbing until dry. Now your hands are clean and ready to go. Classrooms and lecture halls will be regularly cleaned by university facility staff in accordance with CDC and OSHA guidelines. Cleaning and disinfecting supplies will be distributed to these areas for occupants to increase the frequency of surface cleaning. Instructions for the use of products will be posted, including chemical and safety information. Please take note that eating and drinking in classrooms, labs, and the library is now prohibited. How to clean and disinfect. Be sure to wear disposable gloves prior to any cleaning. Clean surfaces with the provided cleaner, disinfectant, and paper towels. And follow provided instructions on the specific cleaner you are using. Be sure to clean personal electronic devices including phones, touchscreens, tablets, keyboards, and remote controls. Consider a wipeable cover to put over your device. Follow the manufacturer's instructions on cleaning and disinfecting. If no guidance is available, use alcohol-based wipes or sprays containing at least 70% alcohol. Be sure to dry thoroughly before using. What to do if you are sick or have been exposed. One important and powerful distancing method available is staying home if sick. During normal times, many students come to class even when they may be sick, for example, when they have a cold or are recovering from the flu. These, however, are not normal times, and all students must stay home if sick. You will not be penalized for staying home, and there will be many methodologies available to assist you with your study from home. What to do if you've been exposed. If you've been in close contact with someone who has COVID-19, stay home for 14 days after your last contact and monitor your health. Be sure to contact the University Health Center or your healthcare provider for assistance. Let's have a quick recap. Self-certify your health daily using HawkCheck. Follow guidelines for distancing. Clean and disinfect surfaces. Wash your hands or use hand sanitizer frequently. Wear a face covering. And if you experience any symptoms, please stay home. By following this guide, you are not only protecting your health, but also the health of your fellow Redhawks. Stay safe, everyone. Let's have an awesome academic year. If you have any questions, please contact the Dean of Students at deanofstudents@montclair.edu, the Disability Resource Center at drc@montclair.edu, the Office of Health Promotion at healthpro@montclair.edu, or the University Health Center at askanurse@montclair.edu.